Panic attacks and seizures are two distinct medical conditions that can appear similar but are caused by different physiological changes in the body. A panic attack is often characterized by sudden, intense feelings of fear or discomfort, accompanied by symptoms such as rapid heart rate, sweating, trembling, and a sensation of shortness of breath. In contrast, a seizure typically involves involuntary changes in body movement, behavior, sensation, or consciousness, stemming from an abnormal burst of electrical activity in the brain. Treatments for panic attacks often include therapy and medication to manage anxiety, while seizures may require antiepileptic drugs or other interventions to control or prevent the electrical disturbances in the brain. Risk factors for experiencing panic attacks include stress, certain personality traits, and genetics, whereas seizures can be triggered by factors like epilepsy, high fever, head trauma, or stroke. Here are detailed aspects of the disease. Incidence of consciousness, intact versus impaired. When distinguishing between panic attacks and seizures, the patient's level of consciousness is a crucial factor. During a panic attack, the individual is acutely aware of their surroundings and their symptoms, which might include palpitations, chest pain, shortness of breath, and intense fear of losing control or dying. In contrast, during most types of seizures, particularly generalized tonic-clonic seizures, consciousness is often impaired or lost entirely. The person may experience uncontrollable muscle spasms, and afterward, they often have little to no memory of the event. Recognizing this differential can significantly affect the approach to treatment and necessary medical interventions. Motor control, voluntary versus involuntary. Panic attacks and seizures often share symptoms like trembling and loss of control, which leads to diagnostic confusion. However, a key differentiator lies in motor control. During a panic attack, movements are primarily voluntary. Patients may pace or shake, which is an expression of internal distress. In contrast, seizures, particularly tonic-clonic grand mal types, involve involuntary, vigorous contractions and muscle spasms. Patients typically cannot control these movements, and consciousness may be altered or lost altogether. Recognizing this distinction is crucial in emergency situations, where appropriate and prompt medical intervention, calming reassurance for panic or safeguarding for seizures, can significantly impact outcomes. Sudden onset, emotional trigger versus neurological trigger. When differentiating a panic attack from a seizure, a key distinction lies in their triggers. Panic attacks often arise from emotional or psychological stressors and are typically accompanied by intense fear or anxiety. These episodes are cloaked in a sense of doom, chest pain, and hyperventilation, highlighting their emotional roots. Seizures, conversely, stem from abnormal electrical activity in the brain. They are less emotionally charged but more abrupt, potentially causing convulsions, loss of consciousness, or uncontrolled body movements. The neurological origin of seizures means they can occur without warning and may not be directly linked to an individual's emotional state. Recognizing these variations aids in accurate diagnosis and appropriate treatment for these startling and sudden health events. Symptom duration, brief and episodic versus potentially prolonged. When differentiating between panic attacks and seizures, symptom duration is a crucial factor. Panic attacks typically occur suddenly and are relatively brief, with intense peaks of fear and discomfort that often subside within minutes, rarely lasting longer than an hour. On the contrary, seizures, especially those associated with epilepsy, can have a more variable duration. Some seizures are quick, while others can be prolonged, leading to a state called status epilepticus, a medical emergency that can last more than 5 minutes. This distinction is key in medical contexts, as it guides the urgency and type of intervention needed for patient care. Post-event recovery, rapid normalization versus confusion or fatigue. When distinguishing a panic attack from a seizure, post-event recovery can be a revealing factor. Following a panic attack, individuals typically experience a rapid return to their baseline state without significant confusion or physical exhaustion. They may feel shaken or emotional, but cognitive functions remain intact. Conversely, after a seizure, particularly a tonic-clonic grand mal seizure, an individual often encounters a period of postictal confusion, which can last from minutes to hours. During this postictal state, they may experience memory issues, sluggishness, and profound fatigue, necessitating a longer recovery time before feeling back to normal. This contrast in recovery profiles is a critical point for healthcare providers to consider in their clinical assessment.